Hi everyone, how are you doing today? Still your one and only, the Niger Medical Police Ada. Today I have a scary experience to share. Yeah, a friend called me that her sister had her first child, and the hospital they used, she paid about 250,000, and the husband said he couldn't afford that same hospital, and she was pregnant. She was about 3 months pregnant. So she had to look for another hospital to register, and lo and behold, she found one in Surulere. But before then, she has gone for a scan and confirmed she was 3 months pregnant. So on her getting to register in that hospital, she found out that they had a lot of patients there. Then she registered, and the doctor checked her, said she was going to do a scan, and the doctor did a scan on her. Then after that, the doctor now prescribed some medication for her, and she left. Getting home, she didn't really look at the medication. She just wanted to finish her housework, and when she wanted to take the medication, she looked at it. Lo and behold, it was an abortion-induced drugs. She screamed. The next morning, she went to the hospital, and this person in question is a pharmacist. So when she went back to the hospital, she told the nurse, "I think you gave me somebody else's prescription." The nurse said, "No, they are yours." She said, "Can she see her file?" And lo and behold, the nurse gave her file. And she looked at it. What did she say in the scan, the file? Baby not forming, abort. She screamed. She insisted to see the doctor, but the doctor was not on duty. So she went back home. There and then she called me. And there and then I also called my members, because I have some medical council organs in my team, and we called an emergency meeting. And I kept asking Prof, don't you think this guy is a quack? Prof said this guy is not a quack, he knows what he's doing. But what are we saying? I called the lady. We had a strategy to go, to get something, get the guy talking and also, but because the guy knew that his game was busted, he refused giving audience. And what again? The lady's husband said he doesn't want trouble. I beg, let him carry the doctor should carry his wahala and go. But what am I saying? This thing happened, I think, 3 years ago. As I'm talking to you, the lady just went and registered in another hospital. But as I'm talking to you, she has given birth. The baby is almost 3 years old. When doctors make mistakes, who do we go to? That is why I keep hammering. If there was no name on that medication, that lady would have taken it. If that lady was not a pharmacist, she wouldn't have known that it's abortion-induced drugs. We'll keep on sharing experiences. So if that's the only way we can fight the medical council, so